Hi, I'm Dr. Don Bonner with Personalized Wellness. Today we're going to be doing video number 2 on Dr. Dale Bredesen's book, The End of Alzheimer's. On this video we're going to cover testing. I'm going to try to be as brief as possible, but as you can tell from my whiteboard, Dr. Bredesen recommends a lot of tests in his book. The first thing that I want to get across to everybody is I think everybody should know their genetic status. You have to know your APOE status. If you are a 2-4, 3-4, or 4-4, it's a must that you know that. Because by knowing that status, you can look at these other tests and you can find out what holes you have and start trying to plug those holes up as soon as possible to prevent Alzheimer's. The next thing I recommend for everybody is to have some sort of cognitive testing performed. We use CNS Vitals here at Personalized Wellness. It's included in your initial consult. It takes about 20 minutes to perform on the computer, and it gives us a lot of information, a lot of valuable information. Everything from memory, processing speeds, lots of different things. So I highly recommend that because it'll pick up subtle changes that you're not aware of. And that's very important that we catch the front end of this. And by catching the front end of it, there's many things that we can do with lifestyle, nutrition, supplements, and that sort of things to prevent this onset of Alzheimer's. All right, as you remember, Dr. Dale Bredesen breaks up Alzheimer's into 3 categories. He talks about there being an inflammatory type of Alzheimer's. There's a what he calls his cold type of Alzheimer's, which is really mostly due to deficiencies in things like hormones, nutrients, and that sort of thing. And then the final is the viral or the toxic Alzheimer's. I really think that's the hardest to wrap your arms around and test for, because you're having to test for heavy metals and chemicals and things like that. And I really leave that at the end, because that way we rule out these other things and they're a little bit easier to do, more conventional lab tests. We leave the others till the end because it's much more specialty lab testing and it's more expensive. So, in those we're going to be talking about things like hair samples and urine and provoked samples to test for heavy metals and such as mercury, cadmium, those sorts of things. So we're not going to talk a lot about that because that could be a whole lecture in itself. So the first thing that we need to talk about are glucose, insulin, and hemoglobin A1C. So you need to know where you stand as far as insulin resistance. Are you metabolically flexible? And what is your fasting glucose and your fasting insulin? So we measure that on everybody. If those are high, we want to adjust our diet accordingly to become insulin sensitive. That's a must. Next thing that we would check are signs of inflammation. Highly sensitive CRP, I'd like to see that below 1. Ferritin levels, fibrinogen levels, homocysteine needs to be checked. And again, we check all of these on your initial consult. All right, the next thing that he talks a good bit about are food allergies and intestinal permeability. What I recommend on those, as opposed to testing for those, I think that they're a bit unreliable, especially food allergies. What I do with my patients, I recommend an elimination diet for 4 weeks. We get rid of gluten, dairy, and soy, and we just check and see how you feel after 4 weeks. Generally, that's enough time to start healing your intestines. If I believe that you have intestinal permeability and we do a GI test, a stool test, and it shows intestinal permeability, we'll treat that with supplements to heal your intestinal lining. Everybody needs their vitamin D levels checked. Everybody's low. I can almost make just a blanket statement about that. I have to supplement everybody with vitamin D. And this is Jackson, Mississippi. We get a fair amount of sunshine throughout the year, but again, nearly everybody's low. Thyroid hormone, your sex hormones need to be tested. Again, we test all of those. Stress, HbA axis, and cortisol. This falls under the category of what used to be called adrenal fatigue and that sort of thing. It is not your adrenals, folks. You do not have adrenal fatigue. This is a hypothalamic pituitary adrenal problem. And that means it's coming from your head. And that stress disturbs this axis. Consequently, cortisol can either be increased or decreased. And there's tests that we can run for that. Typically, that's a 4-point salivary test that we do here at Personalized Wellness. Oral pathogens, very, very important. You need to see your dentist every 6 months. I know that, we know that from as we've grown up. But again, very, very important. They have shown on autopsies of Alzheimer's patients that nearly all of them have oral pathogens in these neurofibular tangles. So you need to know that. You need to be checked out. You need to make sure that you don't have gum disease. B vitamin status, mitochondrial function. I check these on nearly every patient, and we use a urine test called an organic acid test. Very, very good test, and it tells us what your B vitamin status is. It also gives us an idea of how your mitochondria function. It gives us a lot of other information also. It can tell us whether or not how you're utilizing your food as far as your fats, your proteins, and your carbohydrates. And again, I can't say enough about an organic acid test. Next, GI infections. We talked about this a bit when we talked about food allergies and intestinal permeabilities. We do these tests with a stool test. That'll tell us whether or not you have parasites or yeast or any other bacterial infections. Small intestinal bacterial overgrowth, that test is done with a breath test. And again, we offer that here at Personalized Wellness also. I don't do the breath test on everybody, but nearly everybody gets a stool test because of the significance of gastrointestinal function. Intestinal permeability is huge, folks. If you have intestinal permeability, 80% of your immune system is around your intestines. And if you're leaking and your immune system is exposed to proteins that it shouldn't be, then you're going to have a higher propensity for allergies and autoimmune disease and many other problems. So GI testing, very, very important. Okay, some of the other things that are pretty simple. This doesn't really fall under testing, but smoking, very, very detrimental. You need to stop smoking, folks. That's all I have to say. Sleep, I've done an entire video on sleep. Check that out. Again, extremely important, and that again falls under the lifestyle portion of the program here at Personalized Wellness. And again, on our initial consult, we hit diet and nutrition extremely heavy on your first visit. We talk sleep and we talk stress management over and over again. I can't say enough about it. And as I've said in the past, 80% of your health, folks, are those three things. And if we can dial those in, you're going to get better. Okay. Exercise, again, we've talked about that in the past. I think everybody needs to get an expanded lipid panel to tell us whether you're having problems with your lipids, whether they're oxidized, whether you're inflamed. Again, another marker of inflammation. We definitely want to know that. Again, I run that on every single patient that comes to the clinic, and very, very important. Copper zinc ratios are important. If your copper zinc ratio is above 1.4, we need to know that. Get that under control, because that's, again, is a risk factor for Alzheimer's. The other things we talked about as far as type 3, mold, chemical exposures, heavy metals, and that sort of thing. I'm going to leave that for another talk, because that's very specialty lab testing. I don't do that on everybody by any means. And I think we have to really feel that you're that type 3 category before we go into ordering those things. All right, that was quick, and I went over a lot of different lab tests. I think that you can get these lab tests done at a reasonable cost by not doing the mold testing, the chemical testing, the heavy metals, and that sort of thing initially. And if you do the initial blood work that we do here at the clinic, plus a 4-point cortisol, a organic acid test, and a stool test, you're looking at least $500 or $600 in testing, and that's fairly conservative. And if those prove fairly negative and we feel like it's the type 3, then the testing will be even more. So be aware, but we have hope, and I think his book, again, is extremely interesting. Very bold statement, the end of Alzheimer's. So if you get a chance, pick the book up and read it. And on the next video, I'm going to be going into treatment and what we can do from after we do this lab testing, what to expect, and the order of treatment, that sort of thing. So check that video out. It'll be coming out in the next 2 weeks or so. And again, I'm Dr. Don Bonner with Personalized Wellness. We're still offering the free phone interviews, consultations, so give us a call. Thank you.